Welcome to your lesson on growth and development for infants. In this lesson, we're going to cover expectations for growth, and then we're going to look at motor, language, psychosocial, and cognitive milestones that we need to be on the lookout for. We're going to chat about how this will affect your patient interactions, and then we're just going to highlight some really important topics for education and patient safety. Just remember that everything we do in peds is going through a developmental filter, and this lesson is where we're going to learn and talk about what that looks like for babies. So infancy is a pretty intense time of life. From birth to 1 year, everything is growing and changing super quickly, and it's a lot for babies and it's a lot for parents to handle. Honestly, I have an 8-month-old, and as soon as I get used to one routine or one thing that we're doing, it changes completely. So yeah, it's a lot. And because it's all happening so quickly, we really have to watch our infants very, very carefully to make sure that we detect any problems early on. So let's get started looking at some of those milestones. Okay, so the physical growth that happens during infancy is occurring more rapidly than it will at any other phase in life. And what this looks like is that babies actually double their birth weight by 6 months, and they triple it by 12 months. And this is why babies totally eat like it's their job. And as you can imagine, there are a lot of things that can throw a baby off course and cause problems with this. And when this happens, it's called failure to thrive or weight faltering. And this is something we really have to watch babies very closely for by weighing them periodically during that first year of life and plotting it on a growth chart. The two most important times to keep an eye on this are just after birth when they're learning to feed, and then again around 6 months or whenever the parents begin the weaning process and start adding in solid foods. Two other really important physical assessment findings that really only come up for infants and young toddlers are the fontanelles. At birth, a baby usually has two open fontanelles, a posterior and an anterior. The posterior closes first, and that usually happens around 1 to 2 months, and the anterior fontanelle closes anywhere from 9 to 18 months. And we pay really close attention to these fontanelles when we assess them because they can tell us a couple of different things. If they are sunken in, the child is likely dehydrated. If they're bulging, then this can be a sign of increasing intracranial pressure, and we definitely don't want to miss either of those things, so make sure you're always assessing fontanelles in infants. Let's talk a little bit about motor development. So one of the most important things that you will come to get a feel for when it comes to assessing babies is their tone. And most of the time that you'll hear a baby described as either having good tone or poor tone. And it's kind of a difficult thing to describe, but basically a baby with hypotonia or poor tone doesn't have the normal tension and stiffness that we would expect to find in their muscles. Sometimes we use the word floppy to describe these babies, and that actually does a pretty good job of depicting what it's like. And if you haven't seen or held a baby with poor tone, take a look at the videos that we have in the resource section. The ones that are titled Typical versus Atypical Development are awesome. They will show you exactly what you need to be looking for in terms of tone. And remember, development is happening from the head down and from the core out. So we're looking for a 3-month-old to be having head and neck control. And if this isn't happening, everything else that's coming up for them in the year is going to be delayed, and they're going to have a really difficult time meeting those other milestones. There are also some really important fine motor skills that happen in the first year of life. Check out the outline for a list of those. Language development really begins around 4 months when a baby is starting to do more than just cry. And it's around 4 months that we start to hear them babble and coo and have really high-pitched squeals. Now, their first words don't usually come around until about 1 year of age, but one thing that's really helpful that you can remember is that they're going to be walking and talking by 1. So those two milestones are really important. So you always want to make sure you know that first words are coming around 1 year, and so are those first steps. Babies are also understanding a lot more than you might expect. By age 1, they know what the word no means, and they can follow simple commands. So you can use that during your interactions with the child. If you keep the directions really simple, they should be able to interact with you. Okay, so for psychosocial development, infancy is all about having a lot of needs and then trusting that they're going to be met. This means that their primary relationship is with the caregiver that is most often feeding them and providing their care. A major milestone that goes along with this that we're really looking for during this time is the social smile. And the social smile usually comes around 6 to 8 weeks, and it tells us a couple of really important things. One, it tells us a baby is getting FaceTime with an adult, and two, it tells us that they are responding to it. So this is a really great indicator that a baby is well cared for and that their cognitive development is right on track. Two other really important cognitive milestones that happen in year 1 are object permanence and stranger anxiety. Both of these develop around 9 months. Object permanence simply means that when a toy or something is moved out of sight or taken away from them, they know that it still exists. Stranger anxiety is self-explanatory. Just know that assessments and nursing care can start to get a little bit more difficult around this time because they've developed this stranger anxiety. So we've covered some really important milestones. Let's move on to sort of looking at safety and patient education that relates to infancy. So 4 common problems that can occur during this age range are failure to thrive, suffocation, injury, and abusive head trauma. And as you can see, these are all very serious problems. We've talked a lot about early detection being so important, but honestly, what we really want in the case of these 4 things is to prevent them from happening in the first place by educating parents and caregivers. You can see how they're all really closely related to the different milestones that we've talked about. So take a look at the patient education section of the outline, because I've given some really good specific information on how you can educate and provide support around these topics. Okay guys, that covers all of the basics for growth and development of infants. Your priority nursing concepts for this age group are human development, patient-centered care, and health promotion. All right, that finishes up our chat on infants. Like I said, a lot is happening in that first year. So let's just quickly highlight the really key points and major things to take away. All right, so number 1, if you can only remember 3 words about infancy, remember trust, tone, and weight. Those 3 things summarize the most important milestones for our babies. Number 2, remember that things are happening really rapidly, which makes them very high risk. So we have to be on the lookout for those really troublesome problems like failure to thrive and abusive head trauma. Number 3, make sure you know those red flags that we've talked about. And if you can pay attention to all those different things and focus your assessments on trust, tone, and weight, you really will know what to be on the lookout for our infant patients. Okay guys, thanks for joining me here. That's it for our lesson on growth and development during infancy. Make sure you check out all those resources that we've attached to this lesson. Remember, those atypical and typical development videos are just great for looking at how to assess a baby. So take a look at those. Now go out, you guys, and be your best self today, and happy nursing.